My name's Gavin Lindberg. I live in Germantown, Maryland. The title I'm most proud of is Evan's dad, and I'm also the co-founder and president of the Evan Foundation, which is an organization that my wife and I established in memory of our son. After Evan passed away in 2010, when he was 7, my wife and I decided that we wanted to honor his fight and we wanted to continue his fight by serving other patients and other families. So we established the Evan Foundation 2011. And of course, Evan was our son's name, but it's also an acronym in the title of the foundation. So it stands for Evan's Victory Against Neuroblastoma. And our goal is simple: bring joy to kids with cancer today and drive progress for a better tomorrow. And we do that through a variety of patient and survivor wellness, research and advocacy and education initiatives. People are looking for insights on research, courses of treatment, options that are available to them. How can they become an advocate? How can they help support, additional research and raise awareness of the disease? We receive a variety of inquiries from people about not only their individual patients, but also the neuroblastoma community and how they can become a part of trying to improve the situation for children with neuroblastoma. This is one of my favorite things to talk about. So this is something that we started way back in 2012, the Evan Foundation Treats and Treasures Cards program. It's a really simple thing. It's starting in the spring of 2012. My wife, Wendy, and I started going to the hematology oncology floor at Children's National in DC with 2 carts, one stacked with treats, fun things to eat, all sorts of candy and snacks and chocolate and you name it. And then the other cart stacked full of treasures, toys and games and puzzles and all sorts of fun things for the kids. Yeah, we just started rounding those carts to every single room on the inpatient floor every Wednesday. And the response that we received, just overwhelming, just an incredible response to this simple act by both patients and parents and siblings. So, here we are in 2025. Tomorrow's Wednesday. We'll be rounding the Treats and Treasures carts tomorrow because we have done so every Wednesday since 2012. You add it all up, and it's something like 16,000 patient visits in Washington, D.C. And, because of the impact that this has had, giving kids a break from treatment, something to look forward to, and really empowering them. This is a key piece to this really simple program. It empowers these kids. They get an opportunity to choose items from the cart. They're in charge in an environment where everything is being done to them. And they are in the hospital for, weeks at a time, months at a time, sometimes, well over a year. And so they have that empowerment, and that's very impactful as well. So we decided to expand the program, and we have done so. We are now approaching 30 hospitals that have Evan Foundation Treats and Treasures cards on their hematology, oncology, either inpatient floors or outpatient clinics. We buy the cart for them. We give them a grant every year to keep the cart well stocked. It's usually child life staff or nurses, sometimes volunteers who steward the program, steward the cart, and make the cart available to their patients. And the feedback we've received on this is overwhelming. And I never, ever in my wildest dreams would I ever have imagined that this simple little thing would have the impact that it's had. And, it's a guesstimate, but we're bringing smiles to approximately 1,500 kids a week across all those hospitals. So it's one of our favorite programs. So folks can reach us on social media and certainly on our website. It's www.evanfoundation.org. And we'd love to hear from people.